Hi friends, I am Dr. Dattaram. I am a surgical gastroenterologist at KIMS Hospital, Hyderabad. So one of the commonest mistake patients do when they have jaundice is that they think it is a disease. Jaundice is not a disease, it's a symptom of an underlying disease. The disease could be a very serious illness like a cancer. Most of the patients with jaundice, even today in this era, they go for unconventional evaluation and treatment. So many of them don't even know what is the cause of jaundice, and they think that for all jaundice the treatment is a blanket treatment. So even I do come across people going for some herbal medicines thinking that it will settle down in no time. So there are multiple occasions where cancer is missed, a easily treatable condition like a gallstone causing jaundice is missed. They come in a state of cholangitis in an extremely sick condition, and many a time a tumor or a cancer of the bile duct or the pancreas is missed because of the wrong evaluation or the wrong approach to the jaundice. So I would say that jaundice is not a simple problem. Jaundice needs evaluation. So jaundice is basically two types: medical jaundice and surgical jaundice. Medical jaundice is that essentially what we see is due to the liver disease, be it an acute liver disease or a chronic liver disease. So, and surgical jaundice is one which is very, very important. Surgical jaundice means there is blockage to the flow of bile, which needs an intervention to relieve the block. So the commonest causes what I see in clinical practice are gallstones causing bile duct obstruction and jaundice, strictures of the bile duct or narrowing of the bile duct due to some inflammatory process like chronic pancreatitis, or tumors. Tumors could be somewhere, anywhere in the periambulary region, or distal bile duct or the lower end of the bile duct, or pancreatic head cancer, or hilum, or higher up of the bile duct malignancies called Klatskin's tumors. Unless you go and get evaluated for the jaundice, it is difficult to find out what is the cause for a jaundice. The simplest tests for jaundice are do an ultrasound abdomen, liver function test. So these are the first and simplest tests what you can do on your own, going to any lab or diagnostic center if you have jaundice. So then you have to consult your gastroenterologist. An ultrasound would tell you what is the likely cause of jaundice, what is the status of the liver, is there any chronic liver disease or any cirrhosis of the liver or any tumor in the liver, or if there are any ductal dilatations, means, or if there is any bile duct dilatation or tumor which is causing jaundice. The left will tell you like what is the level of jaundice, what is the level of bilirubin, what is the direct bilirubin or indirect bilirubin, what are the level of proteins like globulins and albumin, what are the liver enzymes. The most important thing is the liver enzymes, like what we do is SGOT, SGPT and alkaline phosphatase. Usually if there is any liver damage, the acute liver damage, the SGOT, SGPT will be very high. If there is any blockage to the flow of bile, generally the alkaline phosphatase goes up. So this is a simple algorithm. And the blood clotting capacity, what we do something called as, to understand the blood clotting, we do something called as prothrombin time and INR. So these are the few important tests which needs to be done for jaundice. So don't neglect the jaundice, and it's always important to consult the right person and get the right test to hit the proper diagnosis and take appropriate treatment.